Influenza. I think a lot of people find influenza very boring in the post-COVID era. It's like, so what? Do we really care about flu anymore? And the answer is yes. We still need to worry about flu even in the post-COVID era. And I picked this graphic just because I like this picture of a flu virus cracked open so you can see all the material inside the capsid. Okay, so old but should not be forgotten. So these little pictures of California, this one I just downloaded today, it shows the influenza activity level in California as of, I guess this is now about 2 weeks ago. So you can see that right now, it's still pretty minimal, starting to heat up in the Inland Empire. However, looking back to last year, it was really by the end of November is when we were hot in Southern California with very high influenza activity. And that's when we were seeing moderate activity in Los Angeles. And by December, throughout the state, we were in high activity. So don't delay. We're not seeing a lot of flu right now, but we will probably in November. So this October is a perfect time to get your flu vaccine. Now, we know that the flu is a very important cause of morbidity and mortality in transplant recipients and patients with kidney disease. Why is that? It's because those groups are more likely to get pneumonia after they get the flu, either a viral pneumonia directly from the flu or what we call a secondary bacterial pneumonia. And that's what's causing the hospitalization and the death after you get influenza. Now, this was a nice study using inpatient data from the United States. And what they found is that if you had either end-stage kidney disease or if you were older, there was a significant increased odds of dying due to influenza. The other big cause was heart failure with a 1.67 increased death, as well as immunocompromised status, including transplantation. So don't just take my word for it. Here's one of many papers that I could have pulled showing that if you're older or if you have kidney disease, you're really at increased risk from influenza. Now, in terms of efficacy, similar to the story in COVID, unfortunately, the flu vaccine is less effective if you're either on dialysis or taking immunosuppression. One ray of light, however, is that we do have something called the high-dose vaccine, and that is more effective than the standard dose. That's recommended for patients 65 and up. And there is data showing that at least in transplant patients, you get a better antibody response regardless of your age, with the fold improved increase ranging from 1.5 to 2.5 with the higher dose vaccine. Unfortunately, if you're under 65, most insurance companies are not going to pay for the higher dose vaccine, even if you're a transplant patient or you have kidney disease. So better to get something than nothing. So unless you're prepared to pay out of pocket a few $100s for the high dose vaccine, I recommend the standard dose vaccine for all humans, but especially those with comorbidities such as kidney disease, especially those who are transplant recipients. And if you're over 65, get that high dose vaccine. So just like with COVID, although the vaccine is less effective in transplant patients, we've got very nice data from this study of over 600 transplant patients who were diagnosed with influenza, that the odds ratio for pneumonia, hospitalization, and ICU admission was significantly decreased by 0.3 if you were vaccinated for influenza that year, and if antiviral therapy, which is generally Tamiflu or oseltamivir, is initiated early. You've got an increased chance of pneumonia or ICU admission if you're older, if you have greater than 2 comorbidities, and those include diabetes, kidney disease, lung disease, and obesity, and if you are on CellCept. So many of these issues that increase your chance of having severe influenza cannot be modified but accessing antiviral therapy is something you can do something about by reaching out to your doctors and getting tested early. And getting vaccinated is something that you can do to decrease your chance of having severe infection from influenza, getting into the ICU, or dying.